Welcome everyone to the third webinar in our series, Financing the AI Ecosystem for Health. It's a part of the AI and Public Health Expert Dialogues, co-hosted by PATH and OECD and convened under the Public Health Impact through AI, the PhixAi initiative. For those joining us for the first time, PhixAi is PATH's flagship initiative to shape the AI for health ecosystem by accelerating innovations that advance universal health coverage and health equity. My name is Resham. I oversee the initiative and the webinar series. Today, we are joined by an exceptional group of speakers, leaders from governments and global funding agencies and multilateral institutions, who will share perspectives on what financing the AI ecosystem truly means. We invite you to post your questions in the Q&A box throughout the session, and we'll surface some during the open discussion, and speakers may also respond directly in the chat. With that, I'd like to hand over to my colleague and co-host Eric from OECD for his opening remarks and context settings. Thank you.
And thank you very much, Resham, and thank you everyone for attending today, and thank you to all of our speakers. Really, I just wanted to remind people, or for people for whom this is the first webinar that you've attended, this is the third webinar in a series of 6 that we're working on with PATH. The first one really focused on designing AI in low connectivity and resource-constrained systems. That was particularly poignant, thinking about, well, what is the minimum that we need to do in order to enable and unlock the power of AI for the betterment of our health systems and of itself. The second session that we had in July really focused on the people aspects of AI. How do we get a culture that embraces AI and recognizes the risk of AI, but also the risks of not deploying AI in our systems? So we want to be thinking about both of those things, and how do we embrace a culture that encourages safety while also encouraging use. And so we had a significant thoughts in our panel from that. What I'll do while we're starting the webinar, I'll post links that we have. We've posted all of these webinars to YouTube, so that way people can actually have access to them after the fact. So I'll post links to those too, in case people are interested in hearing them. But I'm really thrilled for this topic today, because I fundamentally think that financing is one of those underappreciated aspects of enabling AI responsibly and sustainably from a health perspective. And I'm really looking forward to hearing what are some of the things that people are doing to understand how to fund the responsible adoption of AI that is both sustainable and, for the long run, building our foundations and also enabling optimal use and benefit of AI for people, because that's ultimately what we're trying to do at the end of the day. So I'm very much looking forward to everything that we're hearing from. And with that, I will pass back to you, Resham.
Thank you so much, Eric. So we'll begin with speaker introductions. And to kick things off, I'd like each speaker to introduce yourself with your name, your role, your organization, and perhaps one sentence of your involvement with AI in health. So we could begin with Ross.
Thanks, Resham. Yeah, so Rob Cryer, I'm part of I lead the Country Digital Services team at the Global Fund. It's within the IT department here. And the Global Fund's mandate is the eradication of HIV, TB, and malaria as epidemics, and as such, we help the countries that we're supporting in the adoption of digital health tools, including AI. Thanks.
Thank you, Robert. Ross, over to you.
Thank you, Resham. So my name's Ross Hawkins. I work in...
I'm sorry to interrupt you. We can't hear you actually very clearly.
Can you not hear me at all?
There is an echo in the background.
Oh, is that slightly better?
Not
Yes.
really.
Not really, actually.
No, I might drop off and try and come back on.
Okay, sure.
Yeah.
We can move
Yeah,
on
it was
to
working
Alex.
well a couple of minutes ago. So.
Alex, over to you.
Thanks, Resham. Hopefully you can hear me okay. Alex Grant, I'm the Principal Consultant of the Policy Development Unit working in Ross's division at the Australian Government Department of Disability, Health and Ageing. And I recently led a project in collaboration with Australia's Therapeutic Goods Administration on the feasibility of adopting AI and automation in the evaluation of new prescription medicines.
Thank you, Alex. David?
Thank you. So great to be here. So my name is David Lawson. I'm the policy lead for medical technology at the UK's Department of Health and Social Care. So I guess my primary role is to accelerate adoption and scale up of innovation, including AI as a medical device into the NHS.
Thank you. Ross?
Okay, is that working slightly better?
Yes, thank you.
Wonderful. Thank you very much. So good evening, everyone. My name is Ross Hawkins. I work in the Department of Health here in Australia. I'm coming to you tonight from wonderful Canberra, which is on Ngunnawal country, and pay my respects to elders past, present and emerging. It's really great to be here. I'm going to confess right at the outset that I am not an AI expert, but my field of expertise really comes in health system strategy and policy. So we have an overarching lens, or my team has an overarching lens within the department, looking at kind of what we're doing more broadly in our policy settings here in Australia, and how we can think about AI and kind of its utility and application within those kind of broader kind of policy frames and challenges that we have across the health system. So really looking forward tonight to be able to think about AI through that lens, and particularly talk about some of the work that Alex has been doing within the team as we started to think through some of the kind of financial and budgetary implications of adopting some of those kind of policy responses against some of the challenges that we've got. Thank you.
Thank you, Ross. I'd also like to inform that two of our speakers, Marlies from the World Bank and John from the Global Fund, wouldn't be joining us because of certain extreme weather conditions in the US. And Samir also, unfortunately, wouldn't be joining us because of personal medical emergency. So we are here as is. Moving forward to the opening question and setting the tone. So let's begin with the basics. We'd love to learn more about what each one's organization or country is doing to think about financing the AI ecosystem for health. And Ross, perhaps we could begin with you with that opening question.
Just want to check, was that Ross or Rob?
Ross from the government of Australia.
I heard Ross, so over to you.
a bit interchangeable, Robert. Happy to go first, and I think there's several facets to this kind of thinking for us, because I think kind of there's not only what are we doing in the kind of broader health space, but that comes kind of nestled in what's the government within Australia doing more broadly as we think about our kind of AI ecosystem, we think about our digital transformation kind of more broadly. So I think kind of like from our perspective, we've definitely taken a broader whole of ecosystem approach and really focusing in on kind of those key areas of connectivity, data, infrastructure, workforce capability, and then those kind of long-term system operations. I think I would add one of the complexities within the Australian system is we work within a federated structure. So it's often a case of not just what the federal government's doing, but often what the state and territory governments are doing within that as well. And as you can imagine, sometimes it can be quite complex to get all those different parts of the system kind of working in the same direction and making the kind of same levels of investment. And especially you can imagine interconnectivity amongst those becomes a kind of key challenge. One of the things the government's done to do that is about committing $30 million to research initiatives aimed at AI. I'm hoping that Alex might be able to talk a bit about more about that in a moment. So our government set up a digital transformation agency that kind of runs a ruler over everything every government department does and around significant investment to try and look for where there can be levels of alignment in different projects and different kind of approaches around what each government area are actually doing in terms of its broader kind of digital and AI investment. I think it's fair to say there's a level of skepticism that's been applied over IT and digital in the past. And I think we all know of kind of various parts where governments have spent inordinate amounts of money on digital transformation projects that perhaps haven't delivered the kind of intended benefits that they were set out to do. But I really think there's a level now of kind of close consideration between some of the kind of policy paradigm and thinking, looking at then what does the digital experience look like within that, to then how do we kind of bring those together to what are some of the kind of productivity challenges we're facing into the future. So when we think about things like how can we better use AI to kind of augment our health workforce, not about replacing the workforce, but about thinking about the tools and the techniques that we can use in order to help people to kind of work more efficiently, whether that be through kind of EMRs, whether that be through thinking about the way we do kind of radiography into the future, but what are we doing to help provide those better and supporting tools to enable those kind of precious resources, which are health practitioners, to kind of think and operate. So certainly from a kind of system and a policy perspective, we've seen a much kind of closer alignment of AI and the kind of digital experience becoming part of our kind of business process, and certainly the way in which we can work with our central kind of financial area and our treasury around trying to see kind of funding for a range of projects. We've also kind of been pulling together a digital blueprint and digital strategy for where we're looking to head into the longer term. I think there's definitely a sense from where we are at the moment that this is obviously something that's evolving at a rate of which government can't necessarily make kind of quick and easy decisions on. So we've certainly found that the way we can step out government investment in a kind of longitudinal kind of basis is actually kind of beneficial to us to be able to kind of help create that sense of what is the progress we want to make over time, and what are those policy shifts that we want to see in order to get kind of better benefit in using AI right the way through the health system. I think Alex is going to come on in a minute to talk about how we've seen that in a kind of transformative kind of approach and some of the kind of individual projects, Rashan, but I think that'll probably do for me to start with.
Thank you, Ross. And I think this conversation is going to be interesting, is because we also have David here from the government of UK, and we'll be able to kind of compare and analyze how different high-income countries are kind of working around the AI financing space. So David, over to you. What's your country doing in order to think about the entire ecosystem on AI for health?
I guess I'd probably think at two levels. So in one level, I guess we see AI as another kind of key innovation for the future. So a lot of our work has been around thinking through that innovation kind of pathway, that adoption pathway. So, from research through to regulation, through to assessment for cost effectiveness, then into commissioning, into procurement. So across that pathway, there's a lot of activity within the kind of the NHS about how do we improve that adoption pathway. And the link back to financing is that if we can give clarity on that pathway, and particularly about the length of time it can take to take a concept through those steps into kind of adoption and upscale, then that's essential and crucial for companies that are trying to raise finance to develop their product. So big focus on that kind of adoption pathway. For example, so in terms of that research part, lots of kind of proactive support are available to support funding. So in the UK, we have what's called Innovate UK. They have an AI in Health Fund program. They also provide support and access into what's called the Horizon Europe Health program, which has a focus this year on AI. And alongside that, we also have the National Institute for Health Research, NIHR, who provide a whole array of different kind of grant funding programs to support kind of research, to kind of build the evidence case for developing AI concepts. I'll touch probably later in the webinar about the work around regulation and commissioning in terms of AI. But I guess outside looking at that adoption pathway, the other kind of approach the UK has been taken is also to recognise the need to make some basic investment in infrastructure. So you can't, for example, apply AI tools easily onto paper-based processes. So a lot of the focus in the NHS is actually to get the base infrastructure in terms of basic digitization in place first, to then provide that kind of platform for AI technology to then be adopted. And I guess if I reflect on where in the UK there's most penetration in terms of the use of AI, we find AI in healthcare more prominent in imaging and radiology as opposed to, say, pathology. And the reason for that is because there's been more investment historically in digitizing kind of images, X-ray images, compared to digitizing pathology. So alongside looking at the innovation pathway, trying to speed that up and give clarity, and also to give targeted access to kind of funding, we're also focused on investing on base infrastructure that then enables AI technology to be applied for different use cases.
Thank you, David. And it's great to know that there are organizations, countries focusing on financing the base infrastructure, the basic foundations of the public health systems, of the private health systems, in order for an AI layer to come over it. And so thank you. Robert, over to you. We've understood from two government perspectives as to how they are looking at financing. Coming in from the Global Fund, how is your agency looking or working towards financing the ecosystem for health?
Thanks, Resham, and thanks, David. I'll be interested in some of the regulatory comments you've alluded to later in the webinar. I think that would be really quite interesting. So, so from the Global Fund, I mean, the Global Fund, as the name would imply, we're a funding organisation, and we work actually with over 100 countries, LMIC countries, and we very much are driven by the country needs, and we want them to articulate how they feel digital technologies will support them in their fight against HIV, TB, and malaria, which is our focus, our mandate, and we then take on board the projects or the programs that we make. So to put that in context, so the Global Fund invests around $5 billion a year in its fight against the diseases, and of that, 150 million of that goes into digital health or digital tools in order to be able to support those. And similar to what David was saying, the biggest uptake so far that we're seeing in that is in machine learning, and particularly with digital chest X-rays. So tuberculosis is one of the things that we're particularly focused on, and the ability to take a chest X-ray and to have an AI review that and give feedback on the probability. Actually, it gives the feedback on the probability not just of TB, but now on certainly one of the solutions can give feedback on 20 different pathologies there. So it's a much broader than TB. And I think one interesting metric as to why that's so powerful and why that's so useful is in Western Europe, there are around about 120 radiographers per million people. In Uganda, there is one. We just don't have the capacity or the ability, and you can't find radiographers. They take a long time to train up, and so using tools like AI, which is going to be able to heavily point you in that right direction, is very powerful. But in doing so, when we're looking at funding, there are in the countries that we work in, the first thing to recognize is that every country is different. There are different levels of maturity. They have different capabilities in their ability to adopt the systems, and the solution has to fit with the national system. Again, to David's point, you need to be able to feed the AI system with digital data, and so you have to have at least that. You have to, as I phrase it, you have to feed the beast. You have to have systems there that are generating the data on which the AI tool can run. AI on its own won't help you. So, have you got those systems in place? Do you have a national plan and an ecosystem into which this can be adopted? Because what we really want to avoid, and from a funding perspective, as well as an overall efficiency, is that you don't want point solutions. You want solutions that are sustainable and scalable across those countries. And so not only does it have to fit in with the health strategy and the existing ecosystem of the country that we're supporting, but actually more broader than that is the digitization is not a health issue. It's a national issue, and countries are certainly the countries in which we're working. They're very much looking at the digital public infrastructure that they need. So you need to have power, you need to have connectivity, you need to have these systems in place such that you can plug into them. And you don't want an AI solution or a health solution that doesn't align with the national digital plan, because if you do, it won't be sustainable. Sooner or later, it won't. The clashes or that misfit will become evident, and you'll end up having to change it. So aligning to DPIs is also for us a very key thing in ensuring the funding that we're providing is going to stick. Thanks.
Thank you, Robert. I think you touched on a lot of aspects, inequities, disparities that exist between high and low-income countries, and also the importance of digitization not being a health issue, and focusing on DPIs and the foundational aspects that's needed to strengthen not just public health systems, but public systems in different countries. So thank you for sharing that. Alex, I'd like to come to you if you could share a little bit more in details, perhaps, as to what the Government of Australia and your department is doing for the AI financing of health.
Sure. So we're only just starting to realise the transformative opportunities of AI in the Australian health ecosystem. Domestically, a range of stakeholders have called for sustained funding and sovereign AI capabilities in healthcare. And as a first step, Australia's Department of Industry has published a medical science co-investment plan to outline a lot of those joint investment opportunities for government and industry. So as part of the $30 million commitment that Ross mentioned, Australia's funded the AI Health Knowledge Hub to support AI-driven research and infrastructure in health. And that's really designed to serve as a trusted source of information, address the fragmentation and inconsistency in current AI guidance, and support that equitable adoption of AI across rural, remote, and underserved communities in Australia. And this funding comes from what we call the Medical Research Future Fund under its National Critical Research Infrastructure Initiative. And so that's a $24 billion endowment fund established by the government through a capital investment model managed by a board where the earnings are used to finance medical research and innovation projects only. And so at a departmental level, we recently partnered with our colleagues in Australia's Therapeutic Goods Administration to analyse the feasibility and develop a business case of adopting AI in the regulation of new prescription medicines. And Ross will talk a bit more about this soon, but it was a broad exercise to consider the full opportunity costs of inaction to make clearer decisions about risk and reward that are in the public interest. And this was an interesting case because the TGA trades on trust, and it's a service delivery agency employing very highly specialised staff. And so their responsiveness directly determines Australians' access to effective, safe and high quality medicines, which is a key driver of national productivity. And so after making the case to adopt AI to improve the TGA's workforce productivity, we're now considering how to fund short and longer term solutions that are sustainable and meet the needs of the organisation.
Thank you, Alex. And I'm just glad because these conversations are very educative, and people do get to know and understand which different government agency is having what kind of funding, so they could accordingly approach. So thank you for sharing that with us. I'd like to pause just for about a few minutes before we move on to the round one to see if any of the speakers would like to react or respond to anyone's comments. If there's any alignment or divergent, please feel free to do so. David, do you want to say something?
Yeah, I mean, I guess it's interesting because I sometimes in the UK we often say that we sometimes forget that healthcare also happens outside the UK, and actually some of the challenges, opportunities that we see in the UK are the same across other countries. So my sense is with AI, some of the challenges and opportunities will be the same in in America, Australia, Africa, and other places. I think there is an issue about your legacy infrastructure, and I think with AI, sometimes countries that don't have that legacy are actually in a better position to move faster and move quicker than those health systems with kind of legacy systems. So, which is, I guess, is an interesting perspective. I think the other perspective I have is in terms of adopting technology, we also need to remember the human side, and we need to make sure that, particularly for AI in healthcare, how do we make sure that we keep the citizen front and center, but also the clinician as well. And it's interesting in the UK, some of the kind of research that's been done in terms of appetite for change. We often find that the clinical professional body is maybe more resistant to change than actually the citizen, and the citizens are actually more willing to wanting to embrace new AI technology. So there's something about the kind of human side to this in terms of achieving adoption of AI. The other perspective I guess we see in the UK, which again I suspect is similar elsewhere, is that often the challenge for health systems is that there's so much choice. There's almost too many AI technologies out there, and I guess the challenge for a health system is how do you make an informed choice when there is so much choice, and the evidence level for different products is also variable. So how do you validate different claims around AI, particularly because it's such a new technology? I mean, we wouldn't have had this webinar 10 years ago, whereas now it's everyone is talking about AI in day-to-day life. So, but I guess my main reflection is that many of the challenges that individual health systems see locally, even though the way that the health system is set up and funded, the challenges are often very similar, I think, in terms of barriers to adoption, how to get trust from the citizen, from the clinical professional body, the challenge of so much choice as well.
Thank you, David. I'd like to, if there's any other speaker who would like to say something.
I just quick, if I may, on dosing, because we are suffering the same issues here at the Global Fund, and one of the things that we're probably it's a little bit trite to call it, but one of the things we're looking at is a buyer's guide. How can we look at one thing? I could go to the local supermarket and I can buy a toaster that is AI enabled. Is that helpful? No, it isn't. And so there's a lot of hype, and there's a lot of people jumping on the same bandwagon in order to be able to do that. So we absolutely need to find a way, and this is why it touches, I think, a little bit back on David's earlier comment about what's the regulatory system that we need to put in place. How do we identify good AI from everything else? How do we know we're making the right choices here? Because these investments are substantial, and they are very impactful. I mean, this is we're looking at public health systems and the results of making the bad choice or choosing the wrong system, are significant. And I think there's a real need to try and get that regulatory piece in place, and it's something that I think the governments need to be able to do, because if they want private sector to come in and for private sector to invest, they've got to know that they're investing in something that has a level of regulation, is a fair playing field, and what they're advocating, the value that they're bringing is being recognised. Because it's still a bit chaotic at the moment, and we need to try and. The more that we can impose order, the more people feel comfortable about, or businesses will feel more comfortable about making that those investments in AI, which is something we desperately need to see from the private sector as well as from organisations like ourselves. Thanks.
Thank you, Robert. Dr. Hawkins, so that I don't get so there's no confusion in the pronunciations, I'll call you as Dr. Hawkins. Over to you.
Thanks, Shaman. I think I was just reflecting a little bit on what day.
It's frozen.
Yes, it's froze. It's frozen. Okay. Is there anybody else who would like to chime in?
Maybe if I just come back on
Sure.
the previous comments, I agree with that in terms of clarity, in terms of choice. One of the initiatives that we're doing in the UK is to create a digital tool to provide that kind of comparison and to surface where there is evidence to show it, because the context of the UK is that a large majority of medical technology is actually bought at a local level. So within the NHS, there's over 200 separate hospital organizations. So we have a kind of fairly devolved approach to purchasing decisions to make sure that those choices kind of match with local needs. So what we find is that those decision makers at a local level are not always aware of what options are available, and also are not clear how to validate claims that are made to them. So there's definitely a need to make sure that decision making is informed and evidence based, and it is a challenge at the moment. And this isn't a challenge unique to AI. You could apply this same challenge to other kind of categories of kind of medical technology, where there is this huge array of choice. And also what we find with AI, as well as other medical technology categories, is it's quite a dynamic market. It's moving forward all the time. It's very iterative, and technology is being improved all the time. So it's a difficult market to enter, but it's also a difficult market to buy from as well. So if I compare it to, say, medicines is relatively a smaller range of products of medicines, and you don't have the same rate of iteration, really, and you don't have this. And with a medicine, the medicine is unique to the molecule level until it loses its patent, and then there's generics. Whereas with medical technology, including AI, you have lots of very similar products available in the market, so it's far more crowded, and that can be a challenge.
Thank you. We'll be drawing more on what you're saying, David, in round 1 and 2 as well. I just want to see if Dr. Hawkins is back, but he isn't. So moving on to round 1, and then we can always hear him. So round 1 is about setting the stage, so focusing more on priorities and evaluations. And so while we surface the priorities, financing AI is not only about raising funds, but it's also about how governments, donors, implementation agencies, partners, or innovators could collaborate together, and how the government's donors could decide what to fund, how to assess its impact, and how to balance equity with efficiency as well. So I'd like to begin with David, building on what you've earlier said about how to make informed choices, how to make informed decisions of what to fund, how to fund, where do we put in the money, building on those financial responsibilities that you have, and they are often split between levels of government. So, in your view, what should be financed nationally versus locally when it comes to AI in health? And how can governments create that clarity for implementers and funders?
Thank you. I mean, I guess the first thing I'd say is that clarity over reimbursement is essential for companies. So for companies to be able to secure financing and refinancing as they go through their kind of development process, if they can't provide clarity over what the reimbursement route will be, how they will get their first purchase order, how they will get scale adoption, then it becomes very difficult for those companies to secure financing and to sustain kind of financing. So total clarity for companies in this area is crucial. So I guess in terms of the UK, I guess the context is that last month the government published the 10-year health plan, and that included, in the context of innovation, a commitment to introduce what we've called a rules-based pathway. And what that means is that we'll undertake a kind of very clear upfront prioritization process where we select the most high impact technology, including AI, that meets and addresses the national priorities for the health system. And then we'll then commission NICE, which is UK's kind of assessment organisation, to undertake what's called a technology assessment. And what that means is once NICE have undertaken a TA assessment, if it's a positive recommendation, there is a statutory requirement to fund and implement that recommendation. And that's the reimbursement route that the NHS uses already for medicines. So what we're doing as part of the 10-year plan is deploying the same mechanism into technology. So that'll give a very clear rules-based pathway for those technologies that could have the biggest impacts across the health system. But as I said earlier, the majority of medtech, including AI, is bought at a local level. So what we need to do is ensure consistency of process and decision making at a local level. So early next year, we're introducing a standard methodology for assessing technology. So we're calling it the value-based procurement methodology, just to provide consistency in decision making and how at a local level decision makers are assessing technology and the evidence level that companies are required to provide. So that gives industry clarity in terms of how to kind of sell into the NHS at a local level. And again, as I mentioned earlier, we're also introducing a digital product comparison and evidence validation tool. So this is partly about making sure that local decision makers are aware of all the choices that are available, but also to inform them about the evidence level for those different products to accelerate decision making, and again to kind of give clarity. So from a supplier point of view, if you're supplying, if you have an AI product and you want to supply it into the NHS, then you have clarity about what's the assessment level, what's the evidence level that you need to provide in order to try and win, and have your products adopted. I think the other thing I'd say is that in terms of NICE, what we're also positioning NICE to do is also to provide early assessment of emerging technology. So they've introduced a review process called an early value assessment, an EVA. And what they've now started to do is to take a particular category and assess the technologies that are in that category, the different companies, and make an assessment in terms of cost effectiveness to give clarity to those companies about what's the additional evidence that they should be working towards, but also to help inform the NHS and decision makers in the NHS, to give them confidence about it's okay to invest and adopt this particular AI technology because we've assessed it independently, we've assessed the evidence base, and therefore it's kind of safe to make that commitment, to take that leap. So one of the things that we find from feedback from decision makers is that sometimes they need some confidence or reassurance before they kind of commit to buying kind of new technology, particularly AI, if it's a new kind of novel technology. And I guess part of the role of the national system is to provide the mechanisms to give that confidence where that confidence is merited.
Thank you, David, for providing that robust information. And I'm sure it's going to be helpful for a lot of people who've joined us here. Zooming out towards a little bit more on a systemic and policy aspects, Dr. Hawkins, from a government perspective, ministries face tough decisions on what to finance in AI. And earlier you mentioned about integrating an ecosystem-based approach. So from a whole of government perspective, how should ministries assess AI investments, not just on cost, but on a broader productivity gains, efficiency improvements, and economic impact?
Thanks, Rasham. Can I just check? Can you hear me okay now?
Unfortunately, we can't. There's an echo at your end, actually.
Another really bad
echo? Yeah, it was the same as before. When you dropped off and rejoined, that fixed it.
Yes.
Okay, I'll try again. Thank you.
Okay. Perhaps we could move on. Robert, we could, if great. Okay, so from a funding perspective, and you've already given quite a lot of information about the Global Fund's perspective and how it invests in certain LMICs. How do you weigh requests for AI investments against other pressing health system priorities when reviewing country proposals?
Yes, thank you. We do try and look at each application on its merit. And one of the key things, as I was alluding to earlier, is the solution that's being advocated. We really need to see that it fits into the environment, and it's not just AI for AI's sake. And this is where, for example, we do need to see governments putting in the regulatory framework. We need to find a way of de-risking the investment that we're looking for the private sector to make. And so there's a two-handed thing that we're looking at here is how can national governments help de-risk this with things like regulation? The Global Fund itself is also able to help de-risk by putting up maybe some early stage capital in order to be able to remove some of those early adoption concerns. And then we need the private sector solutions to be able to work with that. And we have to be very clear about what the model is, the financial gains model. And it's somewhat similar, I think, to what David was saying about where are the returns here for that private sector investigation. And part of it is it's not a spot solution. It has to be, we're looking at it from a national perspective. How does this fit into your national perspective? And if, for example, you have things like a health information exchange, will it connect to that? Does it support the new standards such as the HL7 fire standard to be able to interact with other systems that are there? Is the local capacity in place in order to be able to support this? Capacity building is a key thing. That these AI tools aren't simple. They're complex by the nature, and they need the right level of support. We're also looking at it and checking, for example, particularly when from a human rights perspective, what happens to the information what are the biases that are being included in here? How is the data ultimately being used by each one? So again, we have to be confident that those that those are in place, and then again, similar to what was mentioned before, the solution is evidence based. We do know that this solution has been appropriately tested and validated, and it's the right tool for the job. And then we would look to try and support that. Ultimately, there is a difficult discussion to have, as particularly now as financing is getting tighter and tighter, and there are two sort of perspectives. So from do you pay for life-saving drugs, or do you pay for new innovative technology such as AI? It's a difficult call in order to be able to make that distinction. But but looking at it sort of more holistically, one thing is clear is that tools like AI are going to really be able to stretch the dollar, and the efficiencies and the effectivity that they bring on that larger scale are going to pay dividends in the long term. So it's a difficult balance that you have to look at between the short term and the long term approach. Thanks.
Thank you, Robert. And I think the differentiation in choosing between you fund life-saving drugs or AI technologies is a good example. Ross, zooming out again, since you're here, I'd like to ask you the question of, from a whole of government perspective, how should ministries assess AI investments? And not just on cost basis, but also more on a broader productivity gains, economic efficiency improvements.
Can I check? Can you hear me okay?
Yes.
Fantastic. I'm not sure we should talk about AI. I'd give anything for a good laptop and internet connection at the moment. Things are things are a bit choppy here on the internet side. Look, I just wanted to kind of add a little bit to kind of where David was heading before, because I think it's a really key point as we start to think through at the macro level that kind of role of government. What is the role of industry? Where do we kind of want to regulate? Where do we want to incubate ideas? And kind of how does the kind of frame of government work in that way? And I think in Australia, we've got quite an active kind of private healthcare market, about $30 billion, 630 or so private hospitals. And I think there's a kind of really key role for government in how do we think about and encourage others to adopt and actually kind of through that bear a kind of reasonable kind of amount of the capital cost that then the public can learn from. So I think it's a really interesting kind of broader question around investment and around kind of where that innovation comes from and what's the role of government in either nudging and kind of from a behavioral perspective encouraging kind of versus then where do you want to see kind of regulation, because ultimately kind of David was kind of highlighting, you get this kind of 1,000 flowers blooming, multiple products, and how do you get a sense of what's acceptable within that kind of broader ecosystem? But look, when it comes to the question of investment, I think one of the things we know is that kind of typically putting any kind of case to government is really tricky and really problematic because government doesn't necessarily like funding big IT projects. So I think kind of one of the things that we've been thinking about is not just a case of what are we trying to do in terms of the investment frame that sits around kind of AI and innovation, but actually how do we start to kind of move that agenda on to actually be thinking more broadly and thinking about the different layers that exists around kind of costing kind of productivity or kind of lost productivity by the non-adoption. I know the UK has been doing some work of this with the kind of chief health economist because we've been working closely with him as well. So there's kind of a number of countries thinking about these kind of elements, but it's actually looking to the kind of what are the kind of impacts from an organizational workforce lens, but then building out to think about what are the impacts and the costs to citizens, what are the broader costs and impacts to the health system, and then to kind of industry groups in the wider economy. So we've been trying to look at some of those individual factors. So then it's not just about saying, hey, we want to spend $200 million investing in this product and there's a benefit to us in a kind of workforce efficiency kind of lens, but actually thinking kind of more broadly that actually by doing this there's a benefit to citizens Alex talked earlier about the project we've been doing with our Therapeutic Goods Administration. There's a benefit to bringing drugs on earlier in terms of QALYs and DALYs and the impact that that would have. There's a broader impact from a kind of societal lens, but then the kind of sense of the kind of lost productivity kind of part, and what does that mean for kind of our medicine sponsors and the kind of loss of the kind of economic impact to them. And the broader sense we can bring to that economic lens to this, I think will really help us kind of mount the argument for kind of sometimes can be quite modest kind of investments, but the broader impact that has, not just on the kind of individual work area or the kind of the element that we're looking to seek direct benefit from, but some of those kind of broader indirect benefits that we draw through from the kind of economic and productivity lens.
Thank you. Thank you for giving us that system level view. And I think it's very important because we live in an environment where all of us are interconnected in some way or the other. And we have to make those kind of informed decisions for our own country, but also for our fellow countries. So thank you, Dr. Hawkins. Alex, drawing and diving a little bit more deeper into the work Government of Australia is doing, your expertise is in financing models and economic feasibility studies. So what methods or models are most appropriate to evaluate and finance potential AI solutions in health organizations and systems? And for example, should we finance to traditional grant-based models or blended finance or outcome-based models? What are your perspectives on that?
Thank you. Yeah, I want to just go back to what Ross was mentioning about the cost of inaction, because I think it's a very powerful tool because it's drawing on the behavioral economics of loss aversion to make the point that no decision is actually a decision with very real consequences. And then this can be used to calculate the full return on investment and payback period of a range of sensitivity tested options to support that rational public policy decisions and investment decisions. So we think that there's value in calculating this across the usual budget cycle, but also considering those longer term costs and gains. So by calculating that cost of inaction, there's benefit in actually taking time to unpack the specific workflow or business in detail. And so what we did is we identified the technology, the business processes, the people, decisions, pain points, and opportunities at each stage, and where AI could be deployed to achieve efficiencies. And whether that be in touch time, so staff's actual time doing the work, or the cycle time, for instance, how long something might potentially sit on the shelf until it's finalized, and also improving those quality outcomes. So I recommend drawing on feedback from a variety of stakeholders in this process, and that includes those who are the end users and those with lived experience, as well as industry, and look to those international and domestic evaluations of the impact on system inefficiencies or efficiencies. For example, the introduction of new medicines on those productive life years, and as Ross mentioned, the quality adjusted life years. But don't think that you need to undertake a huge amount of primary research to achieve this. You can use secondary research as a baseline. I note Mark asked a question in the chat there about, well, how do you make the case if you don't have that baseline? You can actually find comparable proxies, and then you can adjust the assumptions to reflect your current circumstance, just to get a sense of the order of magnitude of what would be the return. And I would say constantly test the market and look to industry's adoption of AI, because as it's been mentioned, the pace of technological change is accelerating, and you want to ensure that you're investing for 2035, not 2025. So what we did is we prioritized potential solutions by mapping their relative utility versus the effort and the cost of different solutions and financing arrangements, and then overlaying a health equity and ethical lens to mitigate any unintended consequences. But I do think there is value in getting your own house in order first. So ensuring your organization's staff are integrating AI in their work where possible, so they can see the value that it brings before encouraging that broader rollout. And that may require, as David's mentioned, for you to invest in your current systems and base architecture as a first step to demonstrate the productivity benefits and walk the talk and get you in a position where you can then start to adopt AI more broadly. Now, going to the recommended finance models, that really does depend on your context and goals. So grant-based funding is suitable for early stage research and pilots to promote innovation and equity, but it really can lack that scalability and long-term sustainability. Whereas the blended finance can support de-risking investment, particularly for infrastructure-heavy AI projects. And it also recognises that there are significant private benefits that flow from public investment, and that's a way to reflect that value distribution. And the gold standard is moving towards those outcome-based models to align incentives across all stakeholders. However, this does require high-quality data, robust evaluation, and very clear metrics that can often span many years. So this is more appropriate for AI tools targeting chronic disease management, preventative health, population health analytics. And it's worth noting that AI can support the development of such metrics and linking data to understand the connection between, for instance, the social determinants of health and the outcomes that you're trying to achieve. And blending evaluation models and financing can be beneficial to support equity whilst also ensuring the accountability and the economies of scale. But it's important to factor in investment in internal and whole of system governance capacity to really prioritise, test, coordinate, upscale investments and realise those economies of scale and ensure that continuous improvement. And broader AI architecture does require governments to try and keep pace with this technological change and invest in those appropriate policies and guardrails, standards, guidelines to ensure we're clear on what success looks like. And we've got a common framework for evaluating proposals and reducing risk and maintaining that trust and accountability.
Thank you so much, Alex. And in the next round, we'll dive a little bit more deeper into what you've been saying in terms of these blended finance models. I know that we just have 30 minutes left, so I'm going to move to the round 2 on de-risking and ecosystem financing. And I'd like to start with David, because earlier you mentioned about regulations and AI as a medical device. And we know that regulation itself can influence financing risks, especially in AI as a medical device. So when we look at regulation for AI as a medical device, potentially introduces risks. And for companies to raise finance to bring technology to the market. In your perspective, from a government standpoint, how are you approaching the regulation of AI to mitigate this risk and support innovation?
Well, I guess the first thing to say is that probably regulation should be seen as a positive, because we regulate because we need to ensure patient safety. We need to ensure trust in the technology, and trust in the technology is particularly important for AI, I think, to ensure that both the clinician and the patient, the citizen, trust the technology. So sometimes regulation is seen as a negative, but I would turn it around and see regulation as a positive. And frankly, from a commercial point of view, once you've got a technology that is regulated, it does provide a barrier to entry for those other technologies that haven't yet got regulation. So there's a commercial advantage once your technology, if regulation applies, for it to achieve that regulatory approval. But I think, having said that, there is a balance that regulation needs to strike, and the risk of inaction is quite significant in some of the areas that AI technology is targeting. So we need to make sure that regulation doesn't kind of shut out the ability for new technology, for new AI technology to generally innovate and transform kind of healthcare. So there is a balance. So I guess in the UK, MHRA is the regulator, and what they are moving to quite rapidly is they would describe it as a kind of risk proportionate approach, where they're wanting to calibrate the regulations to support innovation by taking a risk proportionate approach. So leaning heavily on post-market surveillance as the way to kind of manage the risk of allowing new innovation onto the market and then ensuring fairly robust post-market surveillance regimes to be in place. And I guess you're seeing this already beginning to kind of be signaled. So a few weeks ago, MHRA made a commitment around unilateral recognition of the CE mark, which is the kind of European regulatory regime, and also a reliance framework with other trusted regulators. So in particular, the FDA in the US, but also the Australian regulator as well, and Canada. And what that means, though, also is that MHRA for the UK can then free up its capacity to create a UK kind of offer for the UK has what's called a CA mark. So that's the UK's kind of sovereign ability to allow devices onto the market. So the direction of travel in the UK is for allowing kind of international recognition from other trusted regulators, but at the same time creating a kind of a risk proportionate regime based around the CA mark to allow market access to be effectively fast tracked, and to particularly be shaped to support novel innovation, AI innovation. And part of that is linked to trying to position the UK as a market that will be attractive for investment in terms of life sciences, and attractive for AI companies to see the UK as a place to bring their product to a market and to use that market to build up the evidence base and then a bridge to get approval elsewhere. So direction of travel in the UK is very much around risk proportionate approach, providing a fast track route with robust post-market surveillance. And then what you're seeing at an international level is discussions with other regulators around how to best align regulation in the future, and to try and get greater consistency in terms of how particularly AI should be regulated. So certainly MHRA working very closely with the FDA and other kind of regulators to try and explore what is the appropriate balance of regulation for AI in particular. And I think the challenge with AI from a regulation point is it does introduce maybe some new risks that are slightly different to other kind of more traditional medical technologies. So particularly from a post-market surveillance perspective, when a traditional medical device has a problem, it normally repeats that problem the same way. So it's quite straightforward to pick up through post-market surveillance. Whereas when AI has a problem, it's sometimes quite random in terms of the errors. So you need a slightly more sophisticated approach to kind of post-market surveillance. But the direction of travel in the UK is about trying to be proportionate and not create too many barriers for allowing new kind of AI innovation in healthcare to come to market.
Thank you, David. I think you've given a great example in terms of the regulation, looking at it from a positive angle, because there are a lot of people who come with an approach and perspective that regulation stifles innovation and so on and so forth. Thank you for that perspective. Zooming out again a little bit from a systemic point of view, Dr. Hawkins, my next question is to you. When we're looking at de-risking adoption in critical, when we're looking at de-risking adoption of AI in core health budgets, so what considerations or mechanisms such as joint international investments or public-private partnerships or phased financing can help governments de-risk AI adoption and embed it into the core budgets?
Yeah, thanks, Sharma. I think kind of you've hit the nail on the head there with some of those kind of key elements. So certainly when I think about this in terms of advice that we're providing to government as we think through some of our policy and kind of some of our AI challenges, certainly the first element you mentioned there around phased financing and demonstrating value to reduce risk is absolutely kind of fundamental. That we find that there can be a bit of a reaction to kind of significant bodies of money and kind of like assuming there's going to be a kind of assumed benefit from that right from the outset. Is probably not the best way in which to try and convince governments to invest, but instead a sense of kind of phasing that financing through, delivering, gaining confidence of decision makers, gaining confidence of government is certainly a kind of key wave that we think about kind of seeking kind of our funding. And certainly the kind of element of that links back to what's the benefit we're deriving from the system. And I think kind of it was David right at the outset that talked about the citizen coming through this, and actually can we start to see what some of the outcomes of the system and the impacts are through that kind of financing and the role of the kind of government. So that is absolutely key. I think the next part for me is thinking about how AI is embedded in strategic priorities, and it's got that kind of key role in terms of where are we going as an organization. Certainly from a Department of Health, Aging, Disability perspective here, the department I work for, kind of digital and technology is a key component of our priorities. So we really try to build it into everything that we do. So again, there's a kind of real consideration that whether we're thinking about preventive health, or we're thinking population health, or we're thinking about hospital funding, there is a real sense of how do we build in, where does AI and digital feature within that kind of thinking and consideration, and kind of form a core part of our policy making. Because where it does have that alignment back up into our broader planning, it's a whole lot easier to argue for the funding that would need to kind of flow in, as we've talked about, in that kind of phased kind of financing way. I think a couple more elements. Pooling resources and co-investment models is absolutely crucial, and certainly this cuts to the kind of government partnerships, how we're working with industry and how we're working with academia, and certainly kind of working through just at the kind of outset around what are we looking to achieve as outcomes, and then using some of those bodies to do the kind of review and evaluation mechanisms as we work through has become incredibly important, and is actually helping in that kind of confidence building and capacity building that we're seeing in the industry. So we're certainly seeing more of those kind of pooled models, bringing in the expertise of academics, the industry experts, and the kind of the role of government within that. The final thing I think about de-risking is learning from early adopters and what other governments are doing. As David's highlighted already, close collaboration between regulators in terms of thinking about therapeutic goods. We see that kind of like that learning right across the kind of broader global system, and a bit of a plug for kind of Eric and the OECD and the kind of work of the Health Committee. There is so much fantastic work and learning going on amongst all of us across our different countries. We don't need to all kind of learn the bad experiences of trying to have to put kind of cases through and what worked and didn't work. There is actually a real opportunity for us to be sharing experiences as a group of countries, learning from what went well and what didn't go well, and then how do we kind of build upon that and bring that back into that broader ecosystem. So I couldn't plug the work of the OECD more. I mean, if you're looking for a kind of that sense of where do some of our evidence and some of our kind of the research come from in terms of benefit and thinking and the kind of trajectory of AI, I think the kind of the work of the OECD and Eric and your team has been pretty phenomenal.
Thank you so much, Dr. Hawkins. And that also smoothly transitions me to my next question to Robert. And I'm going to throw in another question for you on behalf of John, because he is leading the private sector engagement, and you've already kind of in bits answered to the next question. So my first question to you is, what strategies does the Global Fund use to de-risk AI for public health? And how do you ensure financing goes beyond the standalone tools to strengthen and enable the ecosystem together? And my second question is, beyond financial contributions, how can private and philanthropic partners contribute to the ecosystem in terms of expertise, technology, and networks to strengthen and broaden the AI ecosystem, such as from a data system perspective or digital infrastructure or workforce capacity? So please feel free to choose whatever you'd like to answer.
Okay, thank you, Resham. I'll do my best to tackle those. I think the first thing I would say when we're looking at risk, the because we're primarily working in LMICs, the risks perhaps that we see are different from the risks that that Ross and David were alluding to earlier, but not always the case. I mean, because one of the first things we do when we're looking at this is we actually ask the question: does this need AI? Is AI a suitable solution that's required here, or are there other easier, simpler, cheaper solutions that would do a good job in that case? That being said, then again, regulatory support I do see as a positive, and I know people may, as also was alluded, and I think of it negatively, but for the reason stated, that does actually help us de-risk, because it's the sort of thing where you've got the kite mark, or you've got the the approval on the product. It helps take away that risk of what it is you're buying. You know that somebody independently has assessed it, and we very much look for that kind of evidence-based support and the regulation to say that this is a proven solution. The other thing that we also look at in terms of, again, I mentioned it before, it's the fit. Is the solution scalable? Does it fit within the existing ecosystem? And in some cases, we actually want businesses to, they've done a lot on the innovation of AI, but those other components need to catch up in terms of putting together a full package to make sure that the overall solution is going to fit. And that particularly in so again in LMIC. So if I take, for example, in sub-Saharan Africa, there's about 15% of the health facilities in sub-Saharan Africa don't have electricity. 40% of them don't have reliable electricity, and internet connectivity is lagging even more behind that. And so before we go down the AI route, we need to make sure that all of those components, all the required components, are actually in place in order to be able to support it. And this does include, for example, we very much encourage the Ministry of Health to work with the Ministry of ICT, and the Ministry of Health shouldn't be building its own data centers or managing a lot of that IT capability. They've got colleagues in the other ministries that are more than capable of doing it. And again, it fits back to that DPI point I was making earlier. Don't try and reinvent something. It's not your core. It's not your competence, the core competency. The other thing that we also try and do to de-risk is to make sure that, again, we've got the right level of capacity in country in order to be able to do that. And so the training capacity building for us is very important. Particularly, we support things like COVID or TOGAF training, and also you're probably familiar with the DHALP training from PATH. We see as a very strong training course in raising awareness of how all these things fit together. So to sum it all up, you have to take a holistic view of this. You have to step back and you have to look at it, what it is you're trying to do, and make sure that that overall picture, all those pieces are in place. You've got your strategy, you've got your blueprint, and this fits as part of your roadmap. And if all of those are in place, then this does make a sensible investment. It should be scalable and sustainable, and it's not a point solution. So that would be how I would de-risk the procurement side, or the adoption. So then, for beyond the second part of the question, I think was around beyond finance, the sorts of things that we can do. Again, the sorts of things that we're looking at is again, how do we, somewhat along the same lines of the capacity building, but also the technology transfer, Peter. How can we get that knowledge, that ability into local countries? How do we be able to put together kind of training or testing environments? So one of the things that, for example, the Global Fund has, it supports there's the Africa Health Tech Hub in Kigali, as being an example of places where people can come to try and evaluate their solutions and we're funding that. More transparency for transparency through government frameworks and government and accountability. We're supporting these type of approaches to try and make it easier and clearer how to move forward when we invest in when we invest in AI. Thanks.
Resham, can I pick up on what Robert was mentioning there about the importance of obviously, specializing in your area of expertise, but also what David was saying around the benefit of regulation and policies and to de-risk. So in Australia, one of the ways that we've de-risked is by showing that AI is not about replacing the workforce or replacing human decision-making, particularly when it comes to the evaluation of new prescription medicines, but it's actually about augmenting people's roles, and it's about getting the best out of our workforce so they can focus on why we hired them in the first place. And it goes to that public trust, that transparency, that accountability. So the role of government in creating those guardrails and maintaining that trust is really integral, and it's partly a communication and organizational change piece as well.
Thanks. Have we lost Resham?
Yes, I'm back. There's a Wi-Fi issue now at my end, but I just so Robert, I think you've answered it, and has Alex also answered her question? What did I miss? She has.
Alex was adding to and complementing.
Okay, great. Okay, so my next question is to Alex. Alex, focusing more on what you were saying earlier in terms of blended finance and outcome, and moving beyond the gold standard outcome-based models. When we focus on feasibility studies, so how should feasibility studies factor in certain hidden costs when assessing AI proposals at government level and beyond?
Sure. So it does take resources to make a business case, and creating a function like in-house consulting can support the analysis underpinning such business cases. So the Department of Health, Disability and Ageing, we now have this in-house policy capability, and my team worked with the Therapeutic Goods Administration to really analyse their processes and systems and consider how AI can improve touch time and cycle time in the evaluation of new prescription medicines. And going to Mark's point before, we didn't have all of the data. So that in itself is a finding about, well, what could we do if we had all of that? So I think there's benefit in focusing on a handful of high impact case studies and sequencing those investments for impact. So start with projects that offer a balance of lower risk and higher reward to build that momentum and that capability and to support de-risking. And as David's mentioned as well, that data infrastructure and the legacy systems can initially appear a very costly barrier. And it's important to consider if there are any technological prerequisites or if there are some interoperable and meta-sync tools available to help overcome those challenges. So this can support that parallel implementation of AI and longer-term phasing out of your legacy systems to reduce the upfront costs. But as I mentioned, we know that around 70% of AI adoption, it's not a technological issue, it's a people and a process issue. And it does require that investment in organizational change because capability, culture, and context, it can't be fast-tracked. So there's a need to also consider the costs in redesigning business processes and roles to maximize AI benefits and restructuring that data to become AI ready. And that can be a big upfront impost, and it is an iterative process. So it's important to build that into your model. and building and testing, piloting AI tools with end users to ensure it meets their needs and encourages them to become internal AI champions is really critical. So there is this broader workforce training that's required to change the way that we work and become prompt engineers and maximize tools while still maintaining transparency, integrity, and accountability. So there's a need to consider the design and the cost of validation and feedback loops to reduce risk and support that continuous improvement as well. And the resources required to build and maintain AI governance, the guardrails, the policies, and an AI ecosystem to share those learnings and overcome challenges, whether that's within your organization, within government, internationally. And it's important to ensure that those investments are coordinated and that the benefits are being realised across the entire ecosystem to get the most out of what you're initially investing in.
Thank you so much, Alex. This is really helpful and very informative to our audience and to me as well. I want to just pause a little bit before we move to Eric before he gives his closing remarks. Anyone wants to chime in and react or respond to the other speakers' comments, that'll be really helpful. Or if somebody wants to answer a particular question that's been raised by our audience, we can give the space for that as well.
Risham, I've got a question for Robert, if that's okay, because I think it's fascinating what he's talked about through the lens of the Global Fund today. And certainly we do a lot of work here at the department with Pacific countries, which I think kind of suffer in some of the ways of being kind of low income countries that kind of Robert's talked about. And I'm kind of wondering around that kind of sense of innovation, Robert. Often in big governments like Australia or the UK can be quite slow to move and to kind of to innovate. And kind of what do you see through dealing with smaller countries where there is sometimes the kind of need potentially kind of outweighs the kind of potential for kind of regulation or for kind of so much kind of government approval, and kind of where does the kind of innovation sit? Do you think sometimes it's easier to be moving and doing things in low to middle income countries, they're willing to trial more, or do you see that kind of more sitting as the kind of innovation curve sitting through kind of the big economies like G20 nations, you know, UK, US, Australia, and co?
Yeah, thanks, Ross. Interesting question. I think the first thing is that the investment and the pace of innovation that's happening in the Western world, if I could, is really quite high and quite rapid, and in the low middle income countries are never going to be able to compete with that level of innovation to try and to do it themselves. But there is a real willingness to adopt and to understand and to take things forward. Particularly, and again, it was mentioned earlier that you can actually use some of these technologies to leapfrog. They don't have the legacy environment. You can leapfrog forward, or you can really tackle some of the resource constraint issues that we see with a lack of trained medical personnel and bringing in AI to augment it. So there's a huge thirst to be able to do this and a willingness to adopt. But also just want a comment from somebody from Helena, which is Health Informatics Africa. It's the Wild West at the moment. That's the big problem that they have with AI is where do we invest? Where do we put our money? What's the safe bet? We want to do it. We see all the huge potentials that we can get from it, but where should we go? I think is the and that's why we'd like to see a lot more around about evidence-based solutions, and I don't think there's ever going to be a sure bet, but the ones where we can look at the how do we de-risk is very important for the countries where we work. Thanks.
Alex, David, would you like to chime in? We still have 2 minutes with us. A minute.
Yeah, I mean, I guess a positive and a negative. I guess the positive message around AI is that, you know, the necessity is often the mother of innovation, and certainly in the UK, the health system is in need of quite massive transformation if it's to remain sustainable, given demand pressure, demographic pressures, and so forth. So there is a necessity within health systems to make change, because it's not sustainable for health systems to remain as they are. So that's the opportunity, and that's the positive message. I guess the negative message is not all AI is good. And that's the risk. That's the risk for health systems. Just because something is AI doesn't mean it works. And that's part of the kind of challenge and risk judgment that health systems are having to make. It's that's why regulation is important, to make sure that the people are able to trust the technology, because not every AI product that is put in front of you will be good, and some of it could be quite adverse. So there is a caution. So the positive is that there is a pressure to change and transform, and that's a positive momentum. The negative, I guess, is don't assume that all AI works as you think it is intended to.
Thank you so much. Eric, over to you for your closing remarks and weaving the thread.
Well, thank you very much, Resham, and really, really deep appreciation to everyone on the panel today. There was so much richness that came out of this. And in particular, the things that stood out for me was thinking about being more thoughtful, thinking about our financial models that are more outcome-based, really driving the adoption of the systems, but doing so through a risk lens. I think risk is certainly one of the underappreciated areas here, where it is the risk of using the AI systems, but it is also the risks of not using the AI systems, as we heard from both Alex and Ross, that there are opportunity costs that come from not doing things like this. And so we need to think about that. And we also need to think about how to sustain. And one of the important words that I heard early on was, and how to scale. We are very good in health systems of doing the first pilot. We're very bad at scaling. And so I think a robust financial model is something that can help us both evaluate the value of the solution, but also evaluate the solution when it is scaled in order to really foster that type of work. I'm really fascinated by Robert Speyer's guide that he's working on. I'm happy to talk to him about that at some point in time. And keeping the human at the center, that is a theme that has run through all of our various sessions to date. And I think it's going to be really one of the things that is most important, that AI is not about the technology, it's about people. And how do we keep people at the center, both the public and the providers? There is a big change coming, but let's make sure that people are still the center as the outcome that we're trying to achieve. So that said, thank you, everyone. Thank you, everyone, for attending. I'll remind you that next month we'll be having a session on AI in the visible workforce, task shifting and automation risks. And you'll get more information about that in the coming month, especially by joining this webinar. You're automatically on our mailing list. So thank you all. Thank you, everyone, and have a great remainder of your days.
Thank you, Eric. Thank you so much to our speakers and audience for joining us. On behalf of PATH and OECD, may you have a lovely day and a lovely evening ahead. Thank you.
And have a nice sleep there, Ross and Alex.
Thank you for having us. It was a pleasure.
Thank you.